Good evening, everyone. This is Saud Anwar. Um, Today is the 17th of March, 2020. It is about close to 9:30 p.m. One of the issues that everybody is talking about is about the exposed healthcare worker, whether they're sick or whether just been exposed. What is the recommendation? What is the next step? How do we manage that patient? What do we recommend them? First things first, every healthcare worker who is going to be taking care of patients with COVID or presumed COVID or suspicion of COVID 19 needs to have personal protective equipment. They need to have that equipment that is going to help take care of them. So that's a very straightforward understanding. But now, how do we risk stratify and make recommendations, because more and more of our frontline workers are going to get some exposures or risk of exposures, and we will need these people to take care of things. Now, in my reading and understanding and conversations with a number of people, there is no comprehensive strategy or recommendation that is out there. So as of March 17th, 2020, I'm putting this forward, and this is based on some conversations, reading about the illness and our current situation and my background with occupational health, pulmonary medicine, critical care medicine, and learning about COVID-19. This is a recommendation that I'm making. I'm sure people can improve on this, but it's a starting point, so I think it's worthy to put this out there. It's a complex slide, but on the top of the slide, of course, is the sick or exposed healthcare worker and return to work instructions. So on the top left side, there are variables that are worthy to be kept in perspective when we are trying to identify the individual's risk of exposure. So time is a very important variable. If a person is in contact with a patient for a very long time versus just being there for a short duration, the exposure or theoretical exposure to the viruses is going to be less or more depending on the time. If the patient is wearing an appropriate mask and protection in the beginning and also during the assessment, that would actually have an impact on the number of virus exposure. If the healthcare worker has the appropriate level of protection, the recommended protection, which is in the N95 or beyond masks, that actually may also have an impact on the exposure. Having the goggles, because with airborne viruses, eyes can be a source of exposure. Having the gowns and the gloves just tells you about the individual's commitment and the support that they have for protection. And then high risk procedures. There are some situations that lead to a higher risk of procedure exposure. So the plus and minus, or the positive or the negative, are whether they have been either that's been there or not. So based on those variables, and there could be many more variables which we can add, I try to look at the simplified version of this. So the low risk variables would of course look at if a person is wearing goggles, they have the N95 mask, they are actually minimal exposure with the patient is wearing a mask, and there's no high risk procedure, that automatically makes them a low risk exposure. Based on a combination of these stratifications, we can pretty much identify which would be a low risk exposure, what would be a medium risk exposure, and a high risk exposure. So there are so many variables. I just wanted to put this out in front, so we look at the variables, look at our judgment, and identify if the patient has a high, low, or medium risk variable. So that's something that we have to look at from that point of view. The next step is, again, when a healthcare worker gets a respiratory problem, first things first, with respect to their medical issues, their physician is going to be the last call. Their clinician or the doctor who is taking care of them would be the one who's going to be able to assess their condition based on their personal history. So I'm just giving guidelines over here, and this is more focused on how soon can they come back to work and save more lives, if you will. So, and the question to ask is, does that person, the healthcare worker, have an infection symptoms like cough, like fever, shortness of breath, sore throat, body aches, diarrhea, and fatigue? Yes, some people have diarrhea with this as well. And if they do have it, that is going to help us determine which direction to go in. So if they have these symptoms, and the way I'm looking at this right now is when we have community transmission happening. So we are at a different phase in the current situation, at least in the state of Connecticut. And if that is the case, then they could be either low risk, medium risk, or high risk exposure patients. But if they have those symptoms, then I would recommend COVID-19 testing, especially since this testing is becoming more available right now. So if the test is positive, self-quarantine 14 days from the onset of the symptoms, and watch for the complications, especially during the second week. And once where the person is without the symptoms, we want to make sure they are doing well, and they have to connect and talk to the doctor and the experienced individuals. And after that, they would be able to see if they can return back to work and take care of more patients. So that's important. But if the test is negative, so they have these symptoms, the test is negative, they can return back to work in 24 hours after they become asymptomatic. So of course, we don't want you to go back to work if you have fever, shortness of breath, and other symptoms, but they are more likely from other viruses or flu as well. So we want to make sure you don't have flu at that time. And then maybe that's the first thing that should be tested, and that is being tested in many places even right now, because we're in the tail end of flu. So that's something to be looked at. Now, if we want them to have the test and for some reason it's not done, or the patient is refusing, or it's not available, then it's a good idea, just to be on the safe side, to have a self-quarantine for about 7 days. And after the person has been without symptoms for 72 plus hours, and we want to watch their symptoms, they can return back to taking care of the patients if they have been more than 72 hours of stable and symptom-free condition. This is a vague area. This is the area where I wish there was a better way to assess this, but this is probably where we are right now, and then maybe need to be looked at further going down the experience opportunities we will have. So this was the yes answer, that the person has those symptoms. Let's say the person is asymptomatic. They do not have any signs of signs of infection. What do we do at that time? Well, that's where our risk stratification comes in. So if there's a low risk exposure and they're asymptomatic, there is no work restriction. You watch for symptoms and you make sure they have better protection in education. And there is very low recommendation to have a test at that point for them. Then if they are medium level of exposure, then it's probably a reasonable idea to exclude them from work for 7 days and return if they're asymptomatic. Watch for the symptoms, and there's a moderate recommendation to get tests if available. This is my recommendation, so just take that with a grain of salt. I bet a group of experts will sit down in a few months from now, and they will have those recommendations. The challenge I have is the people who are making those decisions, they don't have those few months, and they don't have these experts sitting down in one place making those decisions. So I'm giving you a starting point, and then I have good rationale for what I'm saying. And then we obviously need to make sure there's a better protection, education, and support for this. So moderate level of recommendation to test a person who has medium risk exposure, who is asymptomatic. Now, a few weeks ago when we had no tests available, the answer would have been no, there's no test available, so why do the test? But in this situation, as we are getting more tests available, it is a good idea to actually test a person who has medium level of exposure. These are asymptomatic people. Now, if you have a high risk exposure, that changes things, and it would be important in the asymptomatic person who has a high risk exposure to exclude them for 14 days, and if they are asymptomatic, or in 7 days time, if we can do a test on them, and if the test is negative, they should return back and then watch for symptoms and have a stronger recommendation to make sure that we reduce their risk going forward for exposures. And I think that's part of the whole idea, and I wanted to put this out there. I have this in a JPEG form and a PDF form and a PowerPoint form as well, and I will share it with people so they can actually share it with others and maybe improve on this. And maybe on the 18th of March there'll be an improvement, or July or 2021 there will be an improvement on this. But as of right now, this is the way to go forward. Hope everyone is staying well and safe, and I want to make sure that our healthcare workers are safe, but also they are not spreading the infection, and they are also being able to save the lives. Thank you so much.